So the topic that I'm going to be presenting on today is on school-based drug prevention programs, a review of what works. My research topic focuses on how effective are school-based drug prevention programs, and a couple of the research articles that I have come across have different findings and results, and what I'm mostly interested on is knowing what is effective and how would that play into the things that I need to take into consideration for when I develop my proposal. So, the research problem. So in this article, the research problem was that there has been a growing concern about school-age children using and experimenting with drugs, and there has been a couple of back and forth in regards to when this type of programming should be implemented. Some of the things that I have come across again is like, for instance, they should start it in elementary school, and there are programs that target that, and famously or a widely known one would be the DARE program. However, that doesn't really show to be very effective, and so I'm more interested in like programs that are more curriculum based and that target students throughout the course of like weeks, and really seeing whether or not the outcomes are positive. So in the US, there has been 36.8% of 8th through 12th graders reported having used an illicit substance during their lifetime. And this is stated by this research article. But more than anything, this research article focuses on two systemic reviews that they came across in the 1990s. And what they are doing now is they want to see how updating information and kind of backtracking too to see what worked then and what will work now, kind of comparing and contrasting this information will help them examine this in more detail and gain more information as to how can they improve it, and more than anything continue to target in this growing concern. Some goals and objectives. Like I said, they want to examine the effectiveness of school-based drug prevention programs in preventing illicit drug use. They had two goals, and the first one is to update the two past systemic reviews by accessing studies conducted after the late 1990s to assess the effectiveness of school-based drug prevention programs in reducing or preventing illicit substance use. Second, they want to compare the results with the reviews of illicit drug use outcomes. So here, when they are talking about illicit drugs, they're mainly talking or referring to tobacco and alcohol, because back then those were the ones that were more widely known as gateway drugs. And illicit substances would be anything like heroin, cocaine, LSD, methamphetamines, all of those. Some of the research questions, they had 3 research questions in the study. And the first one was, do school-based drug prevention programs reduce rates of illicit drug use? The second was, what features are characteristics of effective programs? Do these effective program characteristics differ from those identified as effective in reviews of school-based drug prevention of illicit substance use, such as alcohol and tobacco? So these are the main research questions for this article. For the research hypothesis, it was pretty unclear throughout the whole article. I couldn't really find a specific hypothesis. However, they were trying to determine or to find out whether or not the level of interactivity played a factor into the effectiveness. Whether the level of intensity was another variable that would make a program more effective. And when they were talking about level of intensity, they are talking about teaching the students the connection between managing their emotions and how often, or sometimes, I should say sometimes, some students turn to drugs or other illicit substances to cope with these emotions. So when they are talking about level of intensity, they're talking about how deep should they go into this kind of area, and also who should be delivering this type of programming, which is something that they also focused on. In previous programs, some teachers are trained to run these types of programs, and in others, counselors do deliver this. So that was something that they were curious about and wanted to explore. And also group size being a factor as well. How many participants should be in the group, and whether or not this would impact the cohesiveness of the study. And also, at what developmental point should this programming be employed to reduce the risk? They wanted to know whether they should target this in middle school or in high school. The research method design procedures, they focused on behavioral change or tracking behavioral change. And they used, for methods, they used the narrative approach and meta-analysis. There is a lot of qualitative studies surrounding this topic, but not a lot of quantitative research on this, and they do feel like a combination of the both would be best. And they also want to know the scores from pre-test and post-test to be able to compare the progression or regression with the experimental group and the control group. So the results and conclusions for the study found consistent findings with past reviews investigating the impact. They did find that interactive programs adopting either social influence or competency enhancement components appear to be the most effective approach to school-based drug prevention. And they also did find that the more intensive programs appear to increase program effectiveness, and universal programs may be slightly more effective. However, this research did little to resolve the debate regarding the most appropriate program provider. Still, there's still that kind of debate of whether who should be delivering it or not. And also, policy played a big factor in this, and I didn't really take this into consideration beforehand, but I could see how policy decision-making model could play a factor in this, as far as like how interactive or the curriculum be designed in order to make it interactive. I think that this is important, and in order for it to be introduced in middle school, we would have to work with policymakers to get this introduced at this point, because there is a lot of hesitation to introduce this type of material in middle schools, and that's why it is more likely for it to be presented in high school. So with that being said, this is my small presentation.